Kucharski, and I'm a licensed therapist in Colorado. I've been specializing in eating disorders for quite a while now and trauma-informed therapy. I thought it would be wonderful to be able to bring a training to everybody on how to work with disordered eating from a trauma-informed perspective. So we are going to be having a upcoming training where you're going to be able to learn specific skills and techniques for being able to work with people who experience disordered eating and also have a trauma history. We are aware that trauma often is behind a lot of behaviors that we might struggle with. And so this is a great way for you to be able to learn how to navigate both of these tough topics while meeting your client where they're at from a trauma-informed perspective. This training is going to be geared towards people who have had no experience with disordered eating but really would like to start, as well as people who may have been involved in the field for quite a while but need to bulk up some tips and techniques for working with clients from a more trauma-informed perspective. So please join us. I would love to also field some questions and to give you some ideas on what you might be able to expect from this upcoming training. Okay, so our first question is, what are some red flags of disordered eating? So one of the things that we will be talking about in this training is that there are going to be things that you can be watching for or noticing that your client may be disclosing to you. So a reluctance to talk about food and eating habits might be our first red flag, as well as the perhaps constant struggle with body image, dissatisfaction with how you present, how you look. You might be hearing things consistently about chronic dieting or fad dieting. You might be hearing comments about comparison to others. All of those are things that we will experience frequently from clients, but would also be red flags that this would be an area we would like to explore more with our client. What would be another question? What do I do when a client does not want to address eating in therapy? We want to meet our clients where they're at. And part of looking at this from a trauma informed perspective is that we recognize that consent is going to be incredibly important in this process. Along with that, safe boundaries will be as well. So in the training, we're going to be talking about how to navigate some of those concerning issues related to client safety and malnutrition and medical decompensation, while also being able to meet them where they're at and determining what structure or boundaries might need to be in place in order to help them function safely and successfully. We're also going to be talking about higher levels of care and when are we going to know when someone needs a higher level of care. And for those clients that are appropriate for the outpatient level of care, we're going to be talking about how to engage them more in being able to talk about their eating safely. Sometimes we may actually need to look at working with some adjunctive providers like a registered dietitian who might be able to help support that process with someone who's not wanting to talk about their eating. As well as how to use the coping techniques that they already have and the therapeutic skills we already have to be able to help them more comfortably and safely talk about their disordered eating patterns and behaviors. What are your recommendations for how to assess clients' eating habits? In the training, I'm going to give you several assessments that you can use with your clients at any point in their treatment to be able to determine not only where their current eating habits are at, but then you'll be able to regularly use these to continue monitoring. So when we're assessing their eating habits, a lot of that conversation is going to be happening just through our day-to-day dialogue. And then there are going to be specific techniques and tools that you can use outside of that. Some of those will be assessments that we'll talk about. We'll talk about recovery record and how to use that with clients, and give you some ways to be able to help monitor when you're not always able to be seeing them and talking to them regularly, but want to make sure they're maintaining progress throughout the week. How does intuitive eating work? So intuitive eating is one of my favorite options for helping a client overcome disordered eating. We're going to be talking about the core principles of intuitive eating. We're going to be talking about specific techniques that they can use, such as being able to scale their hunger, scale their levels of fullness, being able to identify, is this an emotional need or a physical need that I'm feeling right now? And how to be able to do this without self-judgment and self-incrimination. So anyone who already has been trained in DBT skills, for example, is going to find that a program like intuitive eating is so helpful in navigating disordered eating with clients and helping them get off of that yo-yo dieting or chronic dieting bandwagon, dissatisfaction with self, and being able to feel like they are much more appropriately regulating their needs, their specific needs. Another question is, when clients have trauma symptoms and eating disorder symptoms, which do you prioritize in treatment? We're going to spend a lot of time talking about why it's generally important to address the disordered eating symptoms first, but from a trauma-informed lens. So what we'll be talking about is how research shows that if we jump too quickly into the trauma, that can actually be destabilizing for a client. So we have to be careful about how we navigate that. The beginning phase of our treatment with a client is going to be really focused on establishing that safety and that rapport, while at the same time attending to the disordered eating behavior. We do have to prioritize that, because if somebody is experiencing a medically compromised state, malnutrition, uh, perhaps they're moving into much more severe types of effects on the body now, such as bone density loss, anemia, things like that. We are going to really need to prioritize that to help navigate that with their medical professionals, perhaps a dietitian. And so the return to their health is going to be really critical, but doing that from a trauma informed lens so that we're also not accidentally further increasing their desire to escape through the use of disordered eating behaviors and compensatory behaviors. Let's take maybe a couple more questions. How can therapists decrease the impact of weight stigma on clients? It's very important for therapists to be aware of their own perspectives and beliefs around weight and body image. We live in a society, a culture that promotes people looking a certain way, being a certain size, and expressing certain behaviors. And a lot of times it can be very difficult for people who have to navigate living outside of those socially acceptable realms on a daily basis. So we're going to talk about fat phobia and how fat phobia continues to struggle, or excuse me, how fat phobia continues to promote our struggles with this. And then as therapists, how we can confront and challenge our own biases and be aware of them to help our clients be able to navigate that, while also being able to internally and externally normalize for them these fears and concerns that they've had that have led to these behaviors. I see a question here that says, as a therapist, I struggle with my own weight and body image. Can I still work with clients on these issues? Will this training cover how to deal with my own reactions to my clients? Yes, you absolutely still can work with these issues with your clients. We will talk about how, generally speaking, it's best for us also to be doing this work as well. Obviously, with boundaries, we're not going to be discussing our process with our clients, but it is completely normal, and it happens frequently, that therapists are doing their own therapeutic work, to be able to confront their own biases while helping clients be able to navigate that as well. If for any reason you feel like you would not be able to safely do that at this time, or you feel like you yourself might be medically compromised, that's understandable. And if you need to perhaps focus on that and attend to these emerging topics with your clients at a later date, that would be understandable as well. And then one more question, I believe, had just popped up. What is body positivity? So, body positivity is a phrase that has been coined and been around for quite a while. regarding how we feel about ourselves. We're actually starting to use more of terminology related to body respect or body neutrality because it can be so difficult for people to feel positive all of the times about their bodies, and that term actually has created a little bit more anxiety for a lot of people. So over the years we've learned that while body positivity is still a term you're going to hear frequently that we'll be talking about, we're really going to be focusing on how do we respect our bodies? How do we feel more neutral or neutralized about our bodies? Maybe and maybe that's going to mean that some days we feel very grateful for what our bodies can do for us, and other days we might be struggling, and that's okay. We want to normalize that too, and talk about how we navigate that in this culture that we live in, especially as therapists. So, thank you so much for your participation today. I really look forward to seeing you at the training. And please click on the link above if you would like to register. We have some great things in store.